thanks Lizzie for joining us today. It's been a while since we've kind of had these kind of conversations. I think first and foremost, for everybody that's watching, who are you and what do you do?
So I'm Lizzie, I am a psychologist, I'm a principal forensic psychologist, and I work within a medium secure hospital for teenage boys and girls.
And we've known each other for many years now, and you're always kind of one of my go-to people when I'm trying to understand what's going on. And I guess with the kind of work that we do, responding to issues around youth violence, criminal exploitation, I always kind of feel like there's not a big enough discussion around mental health, trauma, adverse childhood experiences, and we kind of flippantly say these words, but I always wonder, are we actually kind of connecting to individuals that are really skilled and professionals in this particular space? So adverse childhood experiences, let's just kind of start with there. Your understanding of ACEs, what does it mean? And then we'll kind of start looking at things like trauma and whatnot.
Yeah, so there's a really official understanding of ACEs in that ACEs, adverse childhood experiences, is a term used in a collection of research which basically has found that young people, there's 10 traumas in ACEs, there's 10 adverse childhood experiences that predict future life outcomes, and they're all negative. And the idea is that it's cumulative, so the more adverse childhood experiences you've had, the worse your future outcome is going to be in every element: heart disease, how long you're going to live, how well you're going to do at school, in life. It affects every single area of life. But I think when we're talking about adverse childhood experiences, what I like to do is move a little bit away from that phrase and think about childhood trauma.
Okay.
Because ACEs are linked to those 10 experiences. So things like, have you had a parent in prison? Were you ever harmed at home? Whereas there's just so much more trauma our young people have experienced above and beyond those 10.
And I think it's an interesting point to be made, because whilst we talk about youth violence, and as I'm doing a lot of research in this particular space, the literature is saying that we need a public health response to responding to violence, responding to trauma. I even remember a statement saying that adverse childhood experience is kind of like one of the biggest public health threats to our nation. So when you hear of those particular things as it relates to youth violence, what are the things that kind of pop up in your thoughts?
Yeah, my number one thought is that it is. I'm really passionate about we need a paradigm shift, we need a change of approach that supports and front ends our resources in supporting young people. So we know, for example, in the UK, prior to COVID outbreaks, 30% of young people were living in poverty. It's not acceptable, because the impact of that is detrimental for life. And I don't want to live in a country where we think that's acceptable, that we're allowing children to go to skip a meal, to live in houses without kind of flooring, to not be able to attend school. So from an ethical perspective, it's essential. But then when we think about youth violence from a public health perspective, in terms of if we want to keep people in this country alive, we need to address youth violence. And if we want to reduce youth violence, we're going to have to be able to reduce the negative impact of adverse childhood experiences.
And that's my worry, because I was reading a report from the National Youth Agency, another one from BBC Children in Need, another one from the Children's Society, that was kind of not predicting, but kind of set out a series of kind of cause of concerns, 7 to 8, so talking about, young people impacted by their mental health, suicide, self-harm, young people that are homeless. They talk about the digital divide, the haves and the have-nots, when we're talking about kids that have a million education and how many of them actually have a device or connected to the internet. It was talking about abuse, it was talking about risky behaviours where, due to boredom, young people are just kind of like out and about, and it's those types of young people that are more vulnerable and susceptible to issues around criminal exploitation, and so on and so forth. And I think when I'm reading this literature, I'm just like, coming out of the pandemic, this issue of mental health, it's going to be stark, because even the referrals around things like domestic violence and abuse, because of the limitations of organisations that I guess on their outside that would have been able to support young people, they're not there anymore, because of it trying to protect the country and the virus and everything else that's going on. And one of the predicting factors they were saying is, coming out of COVID-19, there's going to be loads of referrals and people talking about the issues happening inside of their households. And I wonder, as a nation, are we going to be able to respond? And if we don't, what are the things that we're most likely going to start seeing?
So today we're not going to be able to respond, because we don't adequately, the country doesn't adequately resource and fund services to respond to mental health and youth violence and youth mental health. So if we continue the way we are, we're not going to be able to respond. We're going to be in a really, really tricky situation. We have the capabilities in this country to respond, and it's a public health concern. It should be our priority to kind of front-end resources to support the outcome of COVID and the outfall of that. But it's going to require a really big change and funding into some of the really essential community services and the initiatives that are in place to try and reduce youth violence and the impact of mental health.